Hey everyone, it's Dr. Vanita, and today we're diving deep into the world of healthcare, specifically Medicaid and Medicare. These government programs provide essential healthcare coverage to millions of Americans, and as healthcare providers, understanding them is crucial. Now you might be wondering, should I contract with these programs? Well, like most things in life, there are pros and cons. On one hand, contracting with Medicaid and Medicare can provide a steady stream of patients and guaranteed payments. On the other hand, it often means dealing with lower reimbursement rates and a whole lot of paperwork. So, in this video, we'll break down the intricacies of Medicaid and Medicare, explore the benefits and drawbacks of contracting with them, and help you decide if it's the right choice for your practice. Let's get started. Alright, let's start with the basics. Imagine healthcare as a giant puzzle with different pieces representing different ways people access care. Medicaid and Medicare, they're two big important pieces. Medicaid, first up. Think of it as a safety net, a joint federal and state program ensuring healthcare access for low-income individuals and families. It's like a helping hand, making sure everyone has a chance at good health, regardless of their financial situation. Now Medicare, on the other hand, is like a well-deserved reward after years of hard work. It's a federal program primarily serving individuals aged 65 and older, those who've paid their dues and now need healthcare support. Additionally, it covers some younger individuals with disabilities because healthcare needs don't always align with age. So where do the healthcare provider fit into this? Well, contracting with these programs means you're agreeing to provide services to Medicaid and Medicare beneficiaries. It's like joining a network, a system where you agree to certain terms and conditions in exchange for access to a vast pool of potential patients. Think of it like this: you're a talented baker with delicious cakes. Contracting with Medicaid and Medicare is like partnering with a delivery service that connects you to customers who need cakes. You bake, they deliver, everyone benefits. But just like any partnership, it's essential to understand the terms of the agreement. Contracting with Medicaid and Medicare comes with its own set of rules, regulations, and reimbursement rates. It's like choosing a specific delivery service. Some might pay more for your cakes but have stricter delivery times, while others might be more flexible but offer lower rates. Understanding the nuances of each program is crucial to making an informed decision for your practice. You wouldn't want to promise a 3-tiered cake with same-day delivery if your oven is too small, right? Similarly, you need to assess if contracting with Medicaid and Medicare aligns with your practice's capabilities and financial goals. In the next few chapters, we'll delve deeper into the specific pros and cons of contracting with these programs. We'll explore the potential benefits, like a steady stream of patients and guaranteed payments, but also address the challenges, like lower reimbursement rates and administrative complexities. So, stay tuned, because by the end of this video, you'll have a clearer picture of whether contracting with Medicaid and Medicare is the right recipe for your healthcare practice. Okay, so we've established the basics of Medicaid and Medicare. Now let's talk about why a healthcare provider like you might consider joining these programs. There are some definite perks. First, imagine not having to constantly hustle for new patients. Contracting with Medicaid and Medicare means a consistent, reliable patient base. It's like a subscription service for your practice. This stability is crucial for providers in areas with limited healthcare access or those just starting out. It's like having a safety net while you build your reputation. And let's talk about payments. With Medicaid and Medicare, you're often guaranteed payment for services. It's like clockwork. You provide care, and the government ensures you get paid. This predictability allows for better financial planning and peace of mind. Contracting with Medicaid and Medicare also means opening your doors to a wider range of patients. You'll serve diverse communities from young families to seniors. This diversity can be incredibly rewarding. You'll make a real difference in the lives of people from all walks of life. And let's not forget the reputational boost. Being a Medicaid and Medicare provider shows your commitment to serving the community. It's like a badge of honor, a testament to your dedication to providing quality care for all. So, we've got a consistent patient base, reliable payments, access to a diverse clientele, and a potential boost to your reputation. These are compelling reasons to consider partnering with Medicaid and Medicare. But, as with any big decision, it's crucial to weigh the pros and cons carefully. Medicaid and Medicare. But let's be real, no system is perfect, and these programs come with their own set of challenges. One of the biggest concerns for many providers is the lower reimbursement rates compared to private insurance. It's like selling your amazing cakes at a discounted price. You're still getting paid, but it might not be as much as you'd like. This difference in reimbursement rates stems from how these programs are funded and structured. They aim to provide affordable healthcare to a large population, which sometimes means providers have to accept lower payments for their services. Now, this doesn't mean you can't run a successful practice while contracting with Medicaid and Medicare. It just means you need to be financially savvy, carefully analyze your costs, and potentially adjust your patient mix to ensure profitability. But it's not just about the money. Another hurdle many providers face is the infamous paperwork and administrative burden associated with these programs. Think mountains of forms, complex coding requirements, and the ever-looming possibility of audits. It's like navigating a labyrinthine bureaucracy. You need to be meticulous, detail-oriented, and maybe have a healthy dose of patience to handle the administrative side of things. This complexity can be time-consuming and might require additional staff or resources. And speaking of time, another challenge is the potentially slower payment cycles compared to private insurance. While Medicaid and Medicare generally guarantee payments, it might take a bit longer to receive them, which can impact your practice's cash flow. It's like waiting for a delicious meal. You know it's coming, but the anticipation can be a bit much, especially if you're hungry. Providers need to factor in these potential delays when managing their finances and ensuring smooth operations. Lastly, contracting with Medicaid and Medicare often means adhering to specific guidelines and regulations that might limit your flexibility in treatment options or billing practices. It's like baking a cake with a predetermined recipe. You have some creative freedom, but you also need to follow the instructions. These regulations are in place to ensure quality care and prevent fraud, but they can sometimes feel restrictive, especially for providers used to more autonomy in their practice. So, we've explored the peaks and valleys of contracting with Medicaid and Medicare. Now the million-dollar question, how do you decide if it's the right fit for your practice? Well, it's like choosing the perfect cake recipe. You need to consider your ingredients, your oven size, and most importantly, your taste preferences. Similarly, deciding whether to contract with these programs requires careful consideration of your practice's unique circumstances. First and foremost, think about your patient demographics. Are you located in an area with a large Medicaid or Medicare population? Do you specialize in treating conditions prevalent among these groups? If so, contracting might be a good way to tap into a substantial patient base. Next, analyze your financial situation. Can your practice handle the potentially lower reimbursement rates from Medicaid and Medicare? Do you have the resources to manage the administrative burden? It's crucial to be realistic about your financial capacity before diving in. Consider your practice size and staffing. Do you have the capacity to handle a potential influx of new patients if you contract with these programs? Will you need to hire additional staff or invest in new equipment? Assessing your operational capabilities is essential. Think about your long-term goals. Do you envision your practice primarily serving a privately insured clientele, or are you open to a more diverse patient mix? Your vision for the future should align with your decision regarding Medicaid and Medicare. And lastly, don't be afraid to get creative. You don't have to choose between exclusively contracting with these programs or opting out entirely. Many providers find a balance by accepting a mix of public and private insurance, creating a diverse and sustainable patient base. It's like offering a variety of cakes on your menu. You cater to different tastes and preferences while ensuring a steady stream of customers. Similarly, finding the right balance in your payer mix can lead to a thriving and impactful practice. Remember, there's no one-size-fits-all answer. The decision to contract with Medicaid and Medicare is highly personal and depends on your unique circumstances and goals. So there you have it, a crash course on navigating the world of Medicaid and Medicare as a healthcare provider. We've explored the benefits like a consistent patient base and guaranteed payments, as well as the challenges, such as lower reimbursement rates and administrative complexities. Ultimately, the decision to contract with these programs is a personal one, a delicate balancing act between your practice's financial well-being, your commitment to serving the community, and your long-term vision. Remember, knowledge is power. By understanding the intricacies of Medicaid and Medicare, you're empowered to make informed decisions that align with your values and set your practice up for success. For more detailed information on contracting with Medicaid and Medicare, be sure to check the links in the description below.